Right. Dr. Parekh, I want to talk to you, too, about this idea that we talked about last week that, some networks are going to be small. You're not going to have your choice of doctor. Your doctor may not be in the insurance exchange that you want. What are people going to find? Are they going to find worse care? So here we are. We've implemented this whole new law, and now care is worse than it used to be?
Well, I think what will happen is a few things. People will notice that there are some dramatic changes. There may be limitations not only to the physicians you can see, but also the services you can get. So you may not, after surgery, be able to get as much physical therapy as you could 1 or 2 years ago. And that may impact your outcomes and how successful the surgery is. I think we are going to figure this out as we go through the process, unfortunately. But already I have patients who've come in seeing me saying that they are not able to follow up with their physicians that they've had for over 10 years because their new policies don't allow them to see those physicians that they've had relationships with and rapports with for years.
Avik?
Yeah, so I actually don't have a problem with the fact that there will be narrow networks under the law. This is an entirely voluntary situation. The government isn't forcing the insurers to have narrow networks with a limited choice of doctors. It's a choice because that results in lower premiums, and consumers want lower premiums. So that's why this is happening. If consumers want to pay higher premiums to have that broader network of doctors, they're free to do so. It's clear that that's not what consumers want.
Will it result in worse care, though?
Not necessarily. Not necessarily.
I want you guys to respond. Obama and Clinton meeting today to push the health care law. I want you to hear what the president had to say and respond. Here's the president.
Let's face it, it's been a little political, this whole Obamacare thing. And so what you've had is an unprecedented effort that you've seen ramp up over the last month or so, in which those who have opposed the idea of universal health care in the first place and have fought this thing tooth and nail through Congress and through the courts and so forth have been trying to scare and discourage people from getting a good deal.
Avik, is the president getting picked on here?
Look, the law is the law. It has the force of the law. The reason why Obamacare will succeed or fail will not be because Republicans don't or do implement it. The federal government is implementing the vast majority of this law. It's going to succeed or fail because it's either workable or it's not.
No. And your bet?
I think it's going to be a mix of both.
Mix of both. Okay. And Dr. Parekh, what do you say? Is it going to be workable? What are we going to find?
Well, I think we don't have a choice. We have to make it workable. And I think we're going to need some innovation to try to make this as workable as possible. But it will be different than what we have today.
Innovation and maybe just a little magic. It's going to take a lot.
That's right.
Avik and Dr. Parekh, thanks for coming on the show tonight. Great conversation. Interesting stuff. We will know, I guess, when we know, starting next week, when people start signing up for those exchanges.